Hi, folks, and welcome to the Art and Science of Awareness. This is our monthly interview series in which we speak with researchers working on the cutting edge of mindfulness science. I'm John Roberts from Living Well Community, your home for interactive and on-demand wellness programming created and curated by Harvard Pilgrim Healthcare and Tufts Health Plan. Now, I'm delighted to be joined this afternoon by Tara Healy, the founder and director of Mind the Moment, the mindfulness program of Harvard Pilgrim Healthcare and Tufts Health Plan, and our very special guest, Dr. Judd Brewer. Now, Judd, among many other things, is the director of research and innovation at Brown University's Mindfulness Center, also the author of multiple best-selling books, including Unwinding Anxiety, How to Break the Cycles of Worry and Fear to Heal Your Mind, and The Hunger Habit, Why We Eat When We're Not Hungry and How to Stop. He is the creator of several app-based digital therapeutics. He recently co-founded Mindshift Recovery, a nonprofit organization dedicated to supporting people who are suffering from addiction, and he collaborated with us to create a website of free resources related to his work. Welcome, Judd. Good to see you this afternoon.
Thanks for having me.
Now, folks, we want you to be a part of this conversation today as well. Do open up the chat. Let us know your thoughts and your questions as they arise at any point during today's program. We will save time at the end to get to those. In the meantime, Tara, I'm going to invite you to take us away. Tara appears to be frozen right now. So, Judd, I am going to take us away. I know Tara's first question was, I guess if there's a bit about how you got yourself into the mindfulness biz. Is this something that you were always interested in from a young age, or was this more of a professional curiosity that arose later?
Well, I kind of fell into this at the beginning of medical school. I remember being pretty stressed out and having, the closest I got to it, and I didn't even know what it was, but I used to play quartet music in high school and really loved being kind of in the flow of playing chamber music. And then during college, we did a lot of backpacking and was really, feeling all I'd say is at ease and connected when I was out in wilderness. But it wasn't until I started medical school that I realized that I was pretty stressed out. And fortunately, this book by John Kabat-Zinn landed in my lap. Started reading it before I started medical school. In my first day of medical school, I started meditating just to see, if it could help me with my stress.
So you are an addiction psychologist by training. Now, that is, I'm assuming you start medical school and you have to figure out a specialization of some sort. But what was it that led you to that as a particular interest that you want to explore?
Yeah, it's funny because I was doing this MD PhD program that was a combination of medical school and getting a PhD. And the joke is that you do medical school for 2 years and then you do your PhD for long enough that you forget everything that you've learned in your 2 years of medical school, and then you go back onto the wards. So when I went back to my third year of medical school, I had no idea what I wanted to specialize in, but I did feel like I didn't remember much. So I actually did psychiatry as my first rotation back on the wards, just to remember how to interview patients. And I really connected with it, loved the process, and realized that it was really aligned with what I've been learning through my own meditation practice and studying Buddhist psychology. And so, the long story short was that I became a psychiatrist once I went through all of my rotations and realized that's really where I felt like I belonged.
Yeah, and so I'm curious about how when mindfulness and the addiction psychology work, when they began to intersect, when you thought to yourself, okay, there's something here, these things might actually support each other in a fruitful way.
Yeah, it was I wasn't really sure at first. So I really kept them pretty separate. I was studying during my PhD years. I was very interested in like why we get sick when we get stressed out, but had mostly been doing, animal models of, how the immune system gets suppressed with stress. And actually, due to some of the Buddhist practice I've been doing, I decided to stop doing animal research and shift to human research During residency, I was fortunate enough to be at a training program. It was at Yale where there was some space in there to do some research during residency. And so during that time, the first 2 years of residency, I was sleep deprived enough that I could, sit back and ponder what type of research I wanted to do. And at that time, I remember thinking, I really want to study mindfulness because I felt like there was this real overlap between where my patients were talking about the same type of language space that the Buddhist psychology was around craving and clinging. And I actually just started, I jumped in and decided to, do my first clinical study during my third year of residency to see if, if this mindfulness stuff worked. Back then it was very, let's just say there was very minimal research in the field. I remember somebody telling me that I was going to kill my career by studying this stuff because it was really seen as rainbows and unicorns. And, I decided, I'd rather fail doing something that I was really interested in than succeed, doing basic science that, that I had learned how to do, but wasn't that passionate about at the time.
Yeah, so I do want to be a little bit immodest on your behalf here, Judd, and talk about you as a bit of a pioneer in the field of digital therapeutics and your work with several apps, including Craving to Quit, Eat Right Now, and Unwinding Anxiety. I'm actually wondering if you could maybe define for folks just what a digital therapeutic is, and your sense of how those are perhaps complementary or in some cases better than other therapies in your experience in your research.
Yeah. The term was coined around the year 2017. And I think it's just a fancy term for delivering, hopefully evidence-based treatment, but it's not all evidence-based, but delivering a treatment through a digital modality. So it could be delivered through the internet, through a web-based format. It could be delivered through an app, which was the territory that we were exploring. And in fact, we started exploring this territory back in 2012 when I was really struggling to help my patients overcome their behaviors, addictive behaviors and habits. We started with smoking, in fact. And I had this thought that I was working at the VA hospital at the time, and we were on a smoke-free campus. So my patients didn't learn to smoke in my office. So what was a way that I could kind of bring my office to them? And that was partially based on thinking about this idea that, people form habits in a certain context. So could we actually treat those habits in context? So, that was, we started studying this. We had no idea whether it would work. And I think it really, asked to your question around how do these compare to other treatments. One way that we were approaching this was that we were seeing in some great work that was coming out of Yale by one of my mentors, Kathy Carroll, and her group, was that therapists can be good at doing therapy, but they're not always great at following up manualized treatment. And she was exploring ways of delivering cognitive behavioral therapy through the web. And we said, well, why don't we just, put it right into an app-based form? Because one of the things that's possible there is that you can have 100% fidelity. People know exactly what they're getting, and they're getting the same thing every time, which also lends itself to research. Opening up the question, does a digital therapeutic even work? We could start to study whether we could help people quit smoking, help people who are struggling with overeating or eating, unhealthy food, or even work with their anxiety. We could study that very carefully because we had a very nice platform that we could look at everything, every component. So we could see how many modules people completed. We could look at how much time they spent on the app, how often they came back to the program. And importantly, we could see if those predicted outcomes like reductions in cigarette smoking, even changes in brain activity, or changes in clinical anxiety scores.
Your first app was Craving to Quit, a smoking cessation app. From there, you went to Eat Right Now, which was about dealing with eating habits, overeating, or eating unhealthfully, and then on to Unwinding Anxiety, which was about dealing with anxiety. I'm curious, it's if you were to say to somebody, okay, smoking is an addictive behavior, sure. Eating, okay, I can see how that might be an addictive behavior, but I'm curious about the anxiety. Does that follow as having addictive patterns related to it, or is it a different modality? Or
Yeah, it's a great question. This actually emerged from a question that some of my patients were asking me. So when we developed the Eat Right Now program and they were mapping out some of their eating habit loops, they were highlighting how anxiety was driving them to eat, stress eat or, eat to distract themselves from unpleasant emotions. And they asked if I could develop an app for anxiety. And at first, I totally blew off the question. I was thinking, well, I'm a psychiatrist. I prescribe medications for anxiety. But that question gnawed at me because about 1 in 5 patients shows a significant reduction in symptoms when you give them the best anxiety medications out there. And some medications like benzodiazepines can have addictive potential. They can be hard to wean off of. They're not magic pills. So I went back and looked at the literature, and it turns out back in the 1980s, ironically, about the same time that Prozac came out, when it was heralded as this magic magic drug, the both for depression, and then there was some research suggesting that it was helpful for anxiety. There was a guy named Thomas Borkovic who suggested that anxiety could be driven through negative reinforcement. And that negative reinforcement process is the exact same way that people form smoking habits, the same way they form unhealthy eating habits. And when I saw that, I'd never learned that in medical school or residency, but this light bulb went off in my head. And I was like, oh, we know how to work with habits. I never thought about anxiety as a habit pattern. And so we developed this unwinding anxiety app. And long story short, we studied it to see if it actually worked. Could we target this specific negative reinforcement mechanism? And in fact, to your question more directly, a lot of my patients talk about being addicted to worrying. I had a patient specifically who I've had many who say that, they just feel like that if they don't worry, they're worried that they're not worrying, because it's so habitual and so, it's just like what they do that they get withdrawal, so to speak, when they're not worrying, and then they'll start worrying. So, long story short, Borkovec suggested that anxiety could be driven through this same negative reinforcement process as any other addiction, and we have the tools to be able to test that and to measure it. And so we actually did several studies. We did a study with anxious physicians, starting with the hardest population to work with. We tend not to take care of ourselves as physicians, but also we did a randomized controlled trial with people with generalized anxiety disorder. So people basically who wake up in the morning, they feel anxious, they start worrying, they worry all day, they go to sleep, they wake up in the middle of the night, anxious and worrying, and then repeat the process. And lo and behold, when we compared usual care, so people could be getting therapy or medications or both, when we just added in the Unwinding Anxiety app, we got a 67% reduction in anxiety compared to 14% with the usual care, which is about what you would expect, about that 1 in 5. And so here we were seeing a very clear differentiation by targeting anxiety kind of at its mechanistic roots, but importantly, taking a slightly different approach than the usual, cognitive approaches, which is, you can think of it as like change your thinking processes. This is really about getting curious about the experience itself, learning how the habits are formed, learning how our minds work, and then learning to work with our minds that way.
Have you received any pushback from, say, other behavioral health experts who might be saying, "This is, an app can't do what I can do," or "This is just not enough," or has there been a fair degree of just support for that therapy?
Well, when you lead with the research, it's hard, at a population level, it's hard to argue with, we got a 64% remission rate versus 3% with the control group. And so when something works pretty well and it can be available to basically anybody with a smartphone, which is most people these days, at a low cost, it ticks the boxes for a lot of public health concerns around, accessibility, fidelity, and things like that. Also, so I think there are some really amazing therapists out there, and unfortunately, there aren't enough. And there are geographic barriers for people. There are also just pragmatic barriers. It can be expensive to go to therapy. If somebody, is a single parent working several jobs, worrying about childcare and things like that, it can just be really challenging to get into therapy. And if you think about, going to therapy even, once a week or once every couple of weeks, it's very different than having access to treatment, basically at your fingertips. So we really see this as an augmentation or even a first line treatment for people that don't have access to traditional treatments. And at the same time can address some of the barriers that have been highlighted in the research around, not all therapists are perfect. Not all of them are bias free, so to speak. Whereas we can make sure that these digital therapeutics are as, equitable as possible.
A new frontier. It's wonderful. So, Joe, we're talking about how anxiety might not be something we might traditionally think of immediately as being, habit based or having an addictive quality to it. I'm wondering if there's other things that people might be doing in their lives that they might not think of as being based in habit or addictive behavior that maybe these sorts of therapies could also work with.
Well, I think there's a new frontier here in looking at any type of habitual behavior that causes problems for us. So it's interesting. The simple definition of addiction that I learned in residency was continued use despite adverse consequences. And so if you just let that sink in, continued use despite adverse consequences, we could be thinking about, texting, for example, like texting while driving has been shown to be very dangerous. And so we could say, well, there's an adverse consequence if somebody, has that urge and can't suppress that urge to pick up their phone and check their text messages while they're driving. That can be adverse consequences if they endanger themselves or others. We also see a lot of, internet-based habits and addictions. So, for example, pornography is a big one that really hasn't been addressed adequately from a public health perspective. We can even look at behaviors like online gambling, which are emerging and growing, unfortunately, given the relatively recent changes in legislature legalizing gambling, where people can be watching a sports game. In the U.S., Sunday football games are a big one where, the sports betting apps advertise, at every commercial, and they can say, oh, you can place a bet on the next play. And so if somebody's bored with a game or frustrated, they can start betting. So you can just see how all of these behaviors can be fine, or if they fall into the category of, continued use despite adverse consequences, they can really lead to harm for people. And that's where I think the same process is at play in terms of reinforcement learning. And so if we can target that same process, we might be able to target some of these other behaviors and expand beyond, eating, anxiety, and things like that.
Yeah, so unfortunate that there's so much to cover, I suppose. But so we're talking about public health benefits, John. And so I wanted to pivot, if we could, to one of your newer projects, which is Mindshift Recovery. I wonder if you could talk about what Mindshift Recovery is and how it might differ from the things you worked with in the past.
I'd be happy to. So we learned a lot over the last decade about how to deliver digital therapeutics, how to study them, how to optimize their efficacy. And my lab has even done some work, a lot of groundbreaking work led by a former graduate student, now a postdoctoral fellow, Bill Nardi, where he was really looking at how can we adapt the programs that we have for people with addictions and then even broaden that to people with any habits. Some of the barriers that we've been seeing are just, pay barriers where, the apps that we've been talking about are behind a paywall. And we really wanted to make access for these types of trainings simpler. We wanted to make it free. And we also wanted to learn from our research to see kind of what's the minimum dose that needs to overcome an unhealthy habit. So we, along with my co-founder, Josh Roman, we formed this nonprofit called Mindshift Recovery. And the idea is, it's for anyone with any habit anywhere. And the idea that we came up with based on all of this research is how can we deliver the training so people really understand how their minds work? how can we deliver this in a very simple way? So there are these core modules. It's not this huge month-long program that our other apps are based on. Can we deliver this in a very short format that's engaging for people? And also, can we cut these into kind of short courses where somebody can focus on, it's a classic, quote unquote, classic addiction, or can they focus on gambling, or can they focus on eating, or can they focus on, if they're struggling with pornography. So it's kind of everything in one place where there's the digital therapeutic component. But importantly, and this was one reason I basically waited 20 years to do this until we learned enough that I felt comfortable that we could. We wanted to pair this with peer support. So we run weekly groups. Again, everything in the entire program is free. So that's one thing that we wanted to make sure that everything was accessible. But we also wanted to make sure that people could, could join us. We do free Zoom groups on a daily basis, and every Thursday, for example, I co-lead a group where people can ask questions. So if somebody is struggling, or they're struggling with one of the concepts, or working with one of their habits, then we can be there to support them. And so far, we've just kind of done a soft launch with it, but so far we've been getting very good feedback. And the idea is to really help anyone with any habit anywhere, and that's the direction we're moving in.
Jill, I just want to thank you for that work. I mean, it's it's an amazing thing to have out there for people to make use of. And I wanted to mention, as a health services company, we have a lot of colleagues who work with members, including members who may be struggling with addictive behaviors and could really benefit from something like Mindshift Recovery. But there also might be folks who say, okay, I don't have time to take or I don't feel like I have the time or effort to take an entire course.
Mhm.
What can I do right now to get some sort of support or relief? I mean, like, are there techniques that you have taught folks that is like more instantaneous, if you will, more in the moment things that, and let's say it maybe a nurse care manager could pass on to a member sort of in the moment.
Mhm. Well, I'll say this with a big caveat, which is there are certainly a lot of practices that can be done in the moment, and I think you all are really good at disseminating a lot of these. If somebody doesn't quite understand how their mind works, this could be seen as a band-aid that they have to just keep reapplying over and over and over. So I just want to be clear about that. To us, it's really important to start with a very basic understanding of how someone's mind works. Now, I think your point is a really good one where somebody might think, "Oh, I don't have time for this." We actually created these first core modules to be about 5 minutes each, and there are only three or four of them. And so I would recommend that people take that 15 minutes. I don't think anybody has come back to us and said that was a waste of time. So that being said, once somebody kind of has a basic understanding of like, oh, here's how these habit patterns form, it actually sets them up to benefit from these practices. And I'll give an example of one. But if they don't have that basic understanding, this could, I'll give my own example. I spent literally 10 years where I was trying to be a very diligent meditation student, where I was given the instruction, pay attention to my breath. And when my mind wandered, to bring it back, these very basic meditation instructions. And I remember going to retreat centers, silent, week long, month long silent meditation retreats in the middle of winter, sweating through my t-shirts because I was working so hard to meditate. And I didn't realize that I wasn't, that wasn't actually serving me because I didn't know why I was supposed to be paying attention to my breath. Now, a little, and maybe the instructors had said something and I'd missed it, and likely the case. But the idea is if I don't know to look for these habitual patterns in my mind, having that anchor of the breath, for example, may not serve me. And I don't want to say worse, but at best, there might be a moment where I feel a little calmer, and then it's gone, and then I want that back. And so I start going, oh, I need to meditate. And then I beat myself for not up for not meditating, or whatever. So I'll pause there. Does that make sense? And then I can give you an example of one of my favorite practices.
Yes, absolutely. Yeah. And I just want to say to folks as well that having known Judd's work for many years, the way that you introduce this material in your work is so clear and just it's so easy for anyone to understand, even if they have no background in mindfulness. So, but please
Oh,
continue.
thank you. I'm glad to hear that. Well, one of my favorite practices that's a nice grounding practice that can be very helpful, when somebody's very, let's say they're very anxious, they're really freaked out. It can be hard to just find ground. It feels like, we're all over the place. And so there's a practice called five finger breathing that I really like, and I've got a YouTube video on it that explains the neuroscience behind it, and we've got it in the Mindshift Recovery app as well. But the basic idea is that as somebody pays attention to their breathing, they're tracing their fingers. So they take the index finger of one hand and put it at the base of the pinky on their other, and as they breathe in, they trace up their pinky paws at the top, and then as they breathe out, they trace down. And you can see over the course of 5 breaths, they've traced their entire hand. Now, this is interesting because it kind of uses up the entire cache of their working memory, because we can't hold a lot of objects in our working memory at once. And we're actually paying attention to four things just in that simple practice. Physical sensations on both our hands, that's two. Physical sensation of breathing, that's three. And then looking at our hand, that's four. So that kind of clears out the cache. And then typically, even after 5 breaths, people report that they feel at least a little calmer, which gives that space so that if a anxious thought comes back in, there's a mismatch in emotional energy where they're thinking, oh, I'm anxious, and their body is saying, yeah, I'm not really feeling it. And it makes it much easier for them to be able to notice that thought and not get caught up in it. So that's a great grounding practice. Somebody can do that for 5 breaths. They can do it for 10 breaths, and it's relatively straightforward. They can teach it to their kids. Their kids can walk them through it when they're anxious and they forget to do it, and their kid wants to help, and their kid can say, "Hey, mom or dad, let's do five finger breathing together." Great practice.
Yeah, and as somebody with a 5-year-old son, almost 5-year-old son, this is something I feel like I could teach him, and that he would love it, and it would almost feel like a kind of a game, but it's one of those stealth ways that we can help people get
Yeah.
a little bit calmer. Judd, so your second app, Eat Right Now, is a wonderful app, wonderful program for managing our how we think about eating. And of course, we are in a time where GLP-1 drugs, your Wegovy, Zepbound, and etc., are very you know uh, prevalent in our healthcare system. I'm curious if you think there is how you would think about a digital therapeutic like Eat Right Now working with those drugs. Can they work together? Is there a way in which perhaps the digital therapeutic could be a replacement? Do you have any sense of this from your own research, your own studying?
It's a great question. So we haven't specifically done the studies, but I've certainly worked with patients who are on a GLP-1 medication for one reason or another. And I think there are a number of different ways that these can work together. One is if somebody's about to start a GLP-1 medication, or hasn't started it yet, but is waiting to be evaluated to see if it's right for them, they can be starting a digital therapeutic. So whether it's, the mini course in the Mindshift Recovery app or the Eat Right Now app or whatever, I think of it this way, is if they can learn how these habitual eating habits are set up. So they can start to work with that. They can also start to learn really the power of their mind in terms of being able to work with cravings, these psychological cravings. And then if they go on the medication, what a lot of people report is, it's basically like a lot of my patients, they just describe having this voice literally gnawing in their head, where it's always fighting themselves around eating, and just kind of having it kind of in the background, or really, in their face. Often they'll report that just kind of drops out, or at least quiets quite a bit, so it's not in their face as much. So that can afford the opportunity to be able to kind of bring in these processes where they're learning how to work with their mind even more. Because what I've seen, and I don't know how often this is the case, but I've definitely seen it, and it's freaked some of my patients out, where those cravings go away, And then suddenly they come roaring back. Nothing has changed in the dose of their medication. Nothing else that we can identify has changed, but something has changed in either their physiology or how they're interacting with the medication. And it's no longer providing that kind of that instant relief. So there, whether it stops working in that way for somebody, or whether they, are have to go off the medication for one reason or another, whether it's insurance coverage or, their body's not tolerating it well or whatever, I think of this as a cross titration. We can ramp up their skills, their mental skills, while the medication is being off ramped. And whether somebody stays on medication a long time, whether somebody has to go off the medication, or whether somebody doesn't have access to the medication, all of those are opportunities for somebody to learn how to work with their own mind. And that the nice thing about that is the more we use those mental muscles, the stronger they get. We don't, you know, they don't stop working as long as we work them, so to speak.
That's great information, Jeff. Thank you so much. I'm going to speak of great information. I'm going to drop into the chat a bunch of links that you can use. Ones to Judd's website, also the Mindshift Recovery site, and some other sites as well. Judd, we're reaching the end here, but I do have one more question, if you don't mind. You are the director of research at Brown University's Mindfulness Center. You oversee a lot of research, including research by graduate students, rising mindfulness scholars. I'm wondering what research is exciting you right now that you're thinking, wow, this is pretty interesting stuff.
Well, there's a lot that excites me. One aspect of the research that we are doing, we just submitted our first paper for publication on this, is really finding accessible ways for people to zoom into their own direct experience that both helps them learn about themselves, but also can be a marker. I think of it as a calibration tool so that they can learn and work with their minds even more. So, for example, we've been exploring some language around that ideally does not even need to be defined so that it doesn't risk being misinterpreted or misunderstood. As an example, with mental states, if somebody feels anxious, we can ask them, okay, if you had to put it in one of two categories, does anxiety, when you're feeling into that anxiety, does it feel more closed and contracted or more open and expanded? And we've done several large studies with hundreds of people at this point, where 90% of the, excuse me, 90% of the time people will report anxiety as feeling closed and contracted, which actually makes sense. It's kind of, fear of the future. You're kind of closing down and protecting yourself from whatever that, perceived danger is. And in contrast to that, let's say if somebody is feeling curious, they tend to report that as more open and expanded. And so we can help people calibrate their experience in a way that's not, doesn't come with judgment. So open, expanded, closed, and contracted is more of a neutral terminology as compared to, good or bad or pleasant or unpleasant. And we can have people then be able to keep an eye out for that type of languaging and use it when they're going through their daily lives. As an example, this just emerged from some of the research that Dr. Nardi was doing, is that people with the trauma history, for example, had found that this terminology, like just checking in to see if they felt more open or closed, was a better way to access their experience where they might not have been as comfortable directing their awareness into their body. And so things like that may be helpful tools for people to stay in the present moment with their experience, but in a way that feels safe and accessible for them. And importantly, we can then use that as a way to link up this reinforcement learning, the cause and effect relationship. So if somebody is feeling, anxiety, they can see, does it feel open or closed? Tends to feel closed. Does closed feel better than open? Well, typically closed feels worse than open. So it can help kind of leverage this negative reinforcement process where they're saying, oh, this anxiety and worrying actually makes me feel worse, which is key to becoming disenchanted with the behavior. So it's easier to shift out of the behavior. And in the same way, generosity, for example, tends to make people feel open and expanded. They can see how rewarding that is because that given the reward difference between open and closed, we choose something that's open. Then people can start to link up, oh, when I do this, I feel open. When I do this, I feel closed, and naturally tap into this reinforcement learning system where they are leaning into and naturally moving toward experiences that tend to be opening. Now that's a hypothesis that we need to formally test in studies, but we've got some preliminary data suggesting that that's where we can be moving with this.
Well, always so exciting to hear about what you're working on, John. As a practitioner, scholar, researcher, author, it's just I want to thank you again for your contributions to the field and to the world. It's always so lovely to talk to you. I really appreciate you making the time today.
Well, thank you. It's been my pleasure.